Hello, viewers. Hope you enjoyed my last session about the PPF account in banks and post office. My name is Malay Karmakar, and you are watching my channel, the Delta Academy. If you like my videos, please put lots of share and subscribe to my channel. Today, I am going to discuss about the cancer, different types of cancer treatments, and what is cancer, and different types of cancer treatment, and the its death rate in India. As India strides into the 21st century, the spectrum of disease has changed from mainly infectious disease to more chronic disease. While cancer has assumed epidemic like proportions, this is due partly to lack of awareness of health promotions and disease prevention, as well as lack of amenities for early diagnosis and treatment. Types of cancer. Cancer refers to an abnormal and unregulated growth of tissues which may invade surrounding normal structure, as well as spread of sites distant from that of origin. Cancer are broadly of three types. Carcinomas 70% arise in membranes and glands, duct of glands. Commonest type of cancer usually spreads to neighboring sites, then to distant sites. Important tissue sites including head, neck, lungs, prostate, breast, esophagus, colorectum, and anus. Uh, Sarcomas arise from bone, muscle, nerve, less common, spread to distant site early. Blood cancers, leukemia, lymphoma, and myeloma. Common cancers. The commonest cancer worldwide in men are lung cancers and prostate cancers, and in women are breast cancers and lung cancer. However, in India, the commonest cancer in men are head, neck cancers, oral cancers in the eastern part of the country, while in women the commonest cancer is uterine cervical cancer. Ironically, both of these are preventable diseases, since head neck cancers are almost always related with use of tobaccos, while cervical cancer arises from chronic infection by human papilloma virus. Symptoms of common cancers, what to watch out for. Causes of cervical cancers can be attributed to the genetic mutation that occurs in the healthy cells of the cervical tissues. Normal cells multiply, grow, and die at a certain rate. Mutation in the DNA changes the fundamental life cycle of the cervical cells that accumulate over time to form a mass known as the cancerous tumor. Symptoms of breast cancer: breast lump, skin changes, ulcer over breast, nipple retraction, discharge, bleeding from nipple, swelling in axilla. Other symptoms may appear in the if the cancer spreads to lungs, liver, brain, bone. Symptoms of head and neck cancer: non-healing mouth ulcers, swallowing difficulty, hoarse voice, chronic cough, hemo, hemoptysis, neck swelling, pain in throat. Other symptoms may appear if the cancer spread to liver, lungs, brain, bone. Symptoms of lung cancer: breathlessness, chest pain, chronic cough, hemophysis. Other symptoms may appear if the cancer spread to liver, lungs, brain, bone. Symptoms of brain tumors: headache, weakness in limbs, visual problems, speech problems, convulsion, loss of consciousness, difficulty in walking, loss of coordination. Symptoms of cancer in GI tract: um, dyspepsia, vomiting and blood vomiting, black stool, bleeding per rectum, lump abdomen, ascites, pain abdomen, pain during defecation, jaundice. Other symptoms may appear if the cancer spreads to liver, lungs, brain, and bone. Symptoms of urinary cancers: hematuria, pain abdomen, frequency of urine and nocturia, pain during passage of urine. Other symptoms may appear if the cancer spreads to liver, lungs, brain, and bone. Symptoms of gynecological cancers: bleeding, PV, vaginal discharge, plain abdomen. Other symptoms may appear if the cancer spreads to liver, lungs, brain, and bone. Cancer prevention: according avoiding smoking and other tobacco products may prevent many cancers, um, as well as chronic heart and lung diseases. Lower consumption of red meat and processed meat, increased consumption of green leafy vegetables, vaccination against human papilloma virus and hepatitis B virus. Cancer screening: many diseases can be diagnosed at a very early stage, even before they produce symptoms, and when treatment will have a much greater benefit. Such diseases may be actively searched for in the general population by a process called screening. Successful screening is possible for cervical cancer, prostate cancer, breast cancer. Cancer detection: cancer symptoms vary according to the site of disease. However, any abnormal lump, sore anywhere in the body, along with any abnormal bleeding or discharge, needs to be reported to the nearest community physician, who can then arrange for further investigation and hospital consultation. Cancer often requires a battery of tests, including blood test, X-ray, endoscopies, CT scan, MRI scan. Cancer diagnosis almost always involves getting a tissue cell sample from the suspicious growth, called a biopsy. Treatment: various treatment modalities are required in treatment of common cancers. These include surgery, radiotherapy, and chemotherapy. Surgery involves operative removal of the tumor with a margin of healthy tissues, and most centers have specialized surgeons for each organ system of the body. Radiotherapy refers to treatment of cancer by X-ray and gamma rays from outside the body or inside. Chemotherapy and targeted therapy are systematic treatment acting on the entire body, usually to prevent or tackle disseminated disease. Treatment modality varies according to site and stage of diseases. Many common cancers in stage 1 or stage 2 can be treated by single modality, either surgery or radiotherapy. More advanced disease usually will also require systemic therapy, while metastatic disease and blood cancers are always solely treated by such systematic therapy. Challenges in cancer control in India. Till now, the focus has been on treating cancer, less or prevention, and even on diagnosis. This is wrong before because some cancer can be prevented and many cancers can be treated more effectively if diagnosis diagnosed early. We need to evolve a more organized network of primary care providers who can be involved with a particular community on a continuous basis. This demands proper funding and education of the primary care providers and a systematic division of the population according to catchment area amongst them. Even in the treatment of cancers, India is running far behind in the number of institutes, doctors, other staffs, and equipment necessary to deal with the hordes of patients. The situation cries out for increased funding on cancer care, setting up of new institutes and training of most more staff than available at present. Cancer care is a expensive business, and too often the patient ability to take and comply with treatment is undermined by their inability to pay. Subsidized government institutes alone cannot cope with the demand. Resource must be pooled. There needs to be a supervising authority in cancer care in every state to guide the patient so that they can get the right treatment at the right time. Modern radiotherapy techniques, MRT, intensity modulated radiotherapy, VMAT, volume modulated arc therapy, IGRT, image guided radiotherapy, SRS, SRT, stereotactic radiosurgery and radiotherapy, SBRT, stereotactic body radiotherapy. How do modern radiotherapy technique optimize cancer outcomes? By providing superior toxicity profile in existing successful treatment setting. Example, IMRT reduces xerostomia in head neck cancer by enabling superior tumor control in existing treatment setting. Example, IMRT and IGRT enables dose escalation in prostate cancer leading to superior disease control by providing disease control solution to innovative treatment setting. Example, SBRT or hepatocellular carcinoma, IMRT, in a form of treatment delivery to achieve high conformal dose contribution, that is treatment dose fits on the target and spares normal tissues as far as possible. Uses control complex dose prescription technique called inverse planning, whereby the physician is able to specify desired dose constraints to the target and normal tissues. Parotid dose, xerostomia, and IMRT. With conventional radiotherapy in head neck cancer, all patients undergo irradiation of parotid gland to a high dose, leading to irreversibly damaged function. This lead to permanent dryness of mouth. Research has shown severe xerostomia. IMRT enables parotid sparing and reduce the possibility of long-term xerostomia. Thus, patients are able to achieve complete recovery of salivary function, facilitating better swallowing and speech function, hence allowing for a better quality of life. Research has also established that sparing of the parotid gland does not negatively impact tumor control. IMRT for prostate cancer. Radiotherapy is the curative option for organ confined prostate cancer. Radiotherapy dose escalation has been shown to improve disease control rates. IMRT allows RT dose escalation while controlling doses to the adjacent and anterior wall of the rectum. Thus, IMRT in prostate cancer enables superior disease control with tolerable toxicity profile. IMRT and VMAT. The linear accelerator treatment head has a array of small blocks called multi-leaf collimators. During IMRT delivery, the MLCs shape the beam aperture in a combination of different irregular shapes. Delivery is comparatively slower at 15 to 20 minutes. VMAT is more sophisticated uh, form of IMRT where not only is treatment more focused but it allows comparatively much faster treatment delivery within 22 to 2.5 minutes. Faster treatment minimizes patient movement and maximizes comfort. IGRT, image guided radiotherapy, is a broad concept whereby frequent imaging is done in the treatment room for more accurate treatment delivery. IGRT is mainly to ensure accurate patient positioning and overcoming problems due to organ motion, due to variation of patient setup and organ motion. An extra margin of tissues has to be radiated to deliver adequate dose of the tumor. IGRT can help us to eliminate or at least reduce this margin. The result is much less normal tissue being irradiated to high doses. Stereo tactic radiotherapy refers to extremely accurate localization of a point in space. Stereostatic radiotherapy refers to a technique of extremely focused radiotherapy. It is usually delivered in a small number of fractions and large dose. Unlike conventional radiotherapy, which is delivered in small doses over a long time, delivering a much higher dose over a shorter course of time allows the radiation to be more effective biologically. The effect of stereotactic radiotherapy is kin to surgery. Uh, Stereotaxy was first achieved in cranial lesions, many of them benign. Example: venous malformations, craniopharyngioma, pituitary adenoma, and acoustic neuroma. These all features treatment of a small target adjacent to vital areas to a dose much higher than the tolerance.
তুই এবেলা যাইতে পারবি না?
যাও 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 যাও।
না না যাইতে এইভাবে
হ্যাঁ যাবো যাবো।
কটার সময়?
আরে যাও না,
আমার এইভাবে কাজ করতে হবে।
আমি যাবো তো, যাবো 5:30-6টার সময় যাবো, যাও।
তাহলে তো আর হবে না, তাহলে আমারই আগে গাড়ি আছে, চালের গাড়ি। তুই তাহলে যাইতে পারবি না?
না আমি যেতে পারবো না।
বাহ, তাহলে আর তোর গাড়ি বার করে রাখতে হবে।
Treatment modality or brain meta states, it has been shown to be equivalent to surgery or whole brain radiotherapy. The first machine to deliver stereo tactic radiotherapy was the gamma knife created by Lars Lexell. This machine uses 201 small telescope source. Today, a cranial stereotaxy can also be delivered by specially equipped linear accelerators. Cranial stereotaxy initially was based on physical and invasively fixing a rigid frame to the patient cranium. The frame was required for the accurate localization of the target on imaging. In the modern day, we have come to use non-invasive frames. Use of sophisticated pre-treatment imaging such as in-room cone beam CT has allowed us to do away with frames altogether. SBRT, also called stereotactic ablative body radiotherapy. So you have understood all the details about the cancer and its cancer treatment. Hope you have enjoyed this session. I'm stopping here today.